Hi, hello, my name is Jade. Welcome back to my channel, or welcome if you are new. Today, I decided it's finally time to talk about my husband's emergency surgery and everything that happened. Yeah, and I figured I could do a little bit of my makeup because I've been wanting to a little bit lately. I haven't been doing it because I have to put eye drops in my eyes constantly, so we'll see how it works today with my constant eye drops. But yeah, I wanted to kind of talk about what happened. It wasn't that bad. The surgery went well and stuff. The thing that the stuff that happened during it, most the not great things kind of happened to me, not my husband. But yeah, so I just figured I would get into it. I have my green tea. I don't know if you could tell. It's a green tea. I made iced green tea yesterday. Big batch of it because I'm trying to drink less coffee. And I don't like the way hot tea tastes. Or, I like hot tea, but I don't always like hot green tea. And I get really nauseous when I drink this. So, I wanted to try iced tea. I don't know. Crazy. But I'm just trying to drink less caffeine or less coffee and more caffeine in a healthy way. So that's why I got my green tea. I'm at my vanity in my bedroom. And, we are going to talk about what happened. So, I guess I should let you guys know what surgery he got. Well, he had appendicitis. I'm not sure what the surgery name is actually called. It was a laparoscopic, something to do with appendix. No one ever actually told us what it was called. They just said, hey, this is what's going on. So he got his appendix out because it was, he had pretty severe appendicitis and it was gonna rupture. So we decided, not even we, the doctor was like, okay, we're gonna take this thing out. Surgery went well, healing's fine. We actually just did his pre-op today. It has been officially 14 days since, I think it's actually been 15, 16 days since he had his surgery. Oh my gosh, I might cry. Yeah, and I wanted to kind of talk about it from the point of view of a visually impaired spouse. This is not something I think a lot of people might deal with because you guys can drive. Or I'm not saying all of you, but there's a lot of people can drive, but I have a lot of guilt left inside because I wasn't there when my husband got the news. But let's start from the beginning. So that day, it was a Monday. My husband had gotten up really early that morning because he had physical therapy and he had an early appointment physical therapy. So he went. I actually didn't wake up when he left. He gave me a kiss while I was sleeping. And yeah, I didn't see him that day that it happened. I didn't see him at all. He got done before work and he called me and he was like, hey, I think I'm going to go over to work early because I have to look over tools because we're going to go on a debt soon, which totally fine, whatever. I was a little upset, I'm not gonna lie, because he was there, he was early by 2, almost 3 hours, and I was like, I wanted to see you, I'm sad about it, but, yeah, it's your job, okay, whatever. So he goes and does that, and then I don't really hear from him until his shift starts, or I think his shift starts, I don't know. I hear from him around 3. I also had therapy that day, so I was in with my therapist. So it wasn't really weird not to hear from my husband. And then, so I had therapy, I was doing all my things, it's Monday. Around, I want to say 6 o'clock in the afternoon, or 6 o'clock in the evening, my husband sends me a text, and he's like, my stomach really hurts. Really, really hurts. And I was like, okay, what side? And he told me his right side. Then I asked him what symptoms he's having, and he kind of explains that it's the right side of the stomach and it goes down. And I was like, okay, that's not good. What kind of pain is it? He explained it to me, and I said, listen, I think you might have appendicitis. I'm not an expert, I'm not gonna lie, but I was a caregiver, and I had to look out for these things. I had to know details on a bunch of random things, and so I kind of know what to look for when it comes to that. I think anyone kind of knows. So I'm not saying I know, but the way he was explaining it to me, and just the way he was acting, I was like, something's wrong, because he normally doesn't really Pain doesn't bother him. He's got a pretty high pain tolerance. So the fact that he's telling me he can't stand up straight, he can't walk, he can't sit. Like, sitting is more comfortable, but, like, it's still not comfortable, but he's just, like, in pain, and he's gonna throw up. I was like, please go to the emergency room. And he didn't want to do that, and I was like, okay, if you don't want to do that, please at least call the nurses line to see what they want you to do. So he called the nurses line. The nurses line asked him a few questions. They asked him the same questions I had, but they were also worried about other issues, like, this might be a little TMI, but testicular torsion. So they were worried that he had a torsion on or in his testicle. And so that's what they were more worried about. They were worried about the appendicitis, but they were like more worried, like, if that's what's happening, you need to get surgery right now. So they sent him to the emergency room, and the emergency room he went to was on a base. It wasn't the base that he works on or anything, and it wasn't close to me. That hospital was like 45 minutes away. So he decided that he was going to go drive himself. I didn't want him to drive himself. I asked him very nicely. I was like, please, please, have someone drive you. I don't want you to be driving if you're in that much pain. And he was like, you know, everyone needs to work. No one could drive me. And I was kind of upset with him, but I understand. I was conflicted because I wanted him to come pick me up so that I could be with him, but also he needed to get there right now. So he didn't end up picking me up. He drove to the emergency room by himself. He called me, so we sat on the phone talking together while he was driving. He used his AirPods, so he didn't have his hands on the phone or anything, but he, you know, we were talking. He wasn't too concerned about it. I was concerned, and I was upset because I wanted him to have someone there with him, because, you know, it's nice to have someone with you when you could potentially get bad news. So I was upset that he was alone, but I also know, you know, he's an adult, I'm an adult, everyone's an adult around us. Sometimes we can't have people with us. So he gets there, he gets checked in, he tells them what's going on, and they get him, like, back pretty quick. They told him at first, like, when he first got there, they're like, yeah, it's gonna be, like, an hour and 30 minutes before you get a room or you get seen. Well, then he described his symptoms, and he wasn't even in the waiting room for 10 minutes, and they pulled him back. So once he gets back there, we're talking a little bit, and he goes and just disappears for 2 hours. I don't hear from him for 2 hours. I am panicking because my husband's the type of person that if something's wrong and he has a way to contact me, he's contacting me. End of story. I'm the first person he's going to contact if something's wrong, if there's something that, you know, needs to be told. Like, he's calling me. That's just the type of person he is. So the fact that it had been 2 hours and I haven't heard anything from him, and he didn't tell me what was going to happen, like, he was just texting, and then all of a sudden he was gone, which it didn't really bother me until it hit, like, an hour and 30 minutes, because I was like, what's taking so long? I've been to the hospital many times. I've had CT scans, I've had MRIs, I've had, you know, all that. I've had ultrasounds. So it was kind of overwhelming that I hadn't heard from him in 2 hours. And I know it doesn't take 2 hours to do a scan. Before this, he did get an ultrasound on his, they ruled out testicular torsion pretty early on. So that, they didn't do the ultrasound while this 2 hours happened. But this 2 hours happened, like, right after his ultrasound. And, I was panicking because I was like, what are they doing that's taking 2 hours? Well, it turns out this hospital's kind of a training hospital. And they were trying to teach someone to get an IV, and it had taken them a long time to stick my husband. He has good veins, but they roll, I guess, and they're strong, and yeah, so I guess they were in there for a long time. He said that they were trying to get it in, and it was really painful, but they got it. After a while, the nurse that was trying to teach the other girl how to do it had to step in because it was too much and it was taking too long. And then they got blood, and then, like, the blood sat there for a little bit, and he said it was weird because they were just playing with his blood in the tubes, but, you know, it's nothing, no big deal. And then he went and got a CAT scan. He had to get a CAT scan I don't know, is a CT and a CAT scan the same thing? He had to get a CT. and he had to get a CT with contrast. And he's had contrast before. It has never bothered him in the past. This time, he threw up. When he told me he threw up, I was like, boy, I know for a fact there's something going on. Because he's had contrast many, many times. It's never made him throw up before. It's never made him nauseous. And then he told me I was feeling nauseous before this all happened. And I was like, you didn't tell me that. But so that's why he was gone for 2 hours, is because he was having a student learn on him to get an IV in. And that took a very long time. And then the CT scan. I don't know why I want to call it a CAT scan. Is it a CAT scan? But yeah. So then after the 2 hours was up, he did reach back out to me. And he's like, yeah, I think I'm going to be sent home in like a few minutes. I think that's nothing. I'm ready to go home. Like, I'm in pain, but yeah. And I was like, sir, they're not sending you home. There's something wrong with you. And then I get this call. I get a call from one of our friends, and he's like, I'm coming to pick you up. And I was like, what do you mean? He's like, I'm coming to pick you up. I'm taking you to the hospital with Chad right now. And I was like, why? And I was like, I don't think I can. I don't have my military ID. And he's like, oh, okay. I was like, hold on. My husband's calling me. Give me a second. And I get on the phone, and my husband is he's not crying yet, but I can hear that it's getting really close. He's getting stressed out. And he tells me, I'm getting emergency surgery. They're taking my appendix out. I have appendicitis. And you won't make it here by the time that surgery starts. And I'm scared. My husband's never had surgery. He has had PRK, which is on his eyes, but nothing was cut open. Like, his stomach wasn't cut open. He wasn't put under anesthesia. So he's freaking out a little bit. And I was like, what? At this point, I'm really upset that I wasn't with him, because I didn't want my husband to be alone to get bad news. I don't think anyone wants their spouse to be alone to get bad news. I was also worried because I was worried I wasn't going to get onto base. I was also worried that I wouldn't be there before he got surgery. And technically I wasn't supposed to. So our friend comes over, he picks me up, we're like racing to the hospital, you know, as you do. And then I had to ask our friend to help me get into the hospital building and to my husband, because I am low vision, and that day I was having really, 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 really bad vision that day. I couldn't see anything. I can't see anything anyways, but yeah. So I asked him to help me get in there, and he was okay with it. He was like, yeah, of course, I'll help you. So when we get there, before we get there, my husband like hung up the phone because he's like, hey, I'm gonna go get surgery. Hung up the phone. So I thought he was getting rolled back, but then he called me back like a few minutes later that they were not going to do surgery tonight because the anesthesiologist was so backed up, so that they were going to admit him and we were going to get surgery first thing in the morning. So I wasn't happy to hear that, but I was also a little happy to hear that because I wanted to be there with him before he went into surgery. He was there with me when I went under for my procedure. I wanted to be there. He actually wasn't there with me when I went under for my procedure. They wouldn't let him, but at least I knew he was in the building. So that's what I wanted to do. So I got there, right? We had to go through the ER because he was still in the ER at this point. And my last name confuses people. My last name is two last names put together with no hyphen. It's just one long name. And no one understands it. I don't understand what's so hard about it, but yeah, they don't. So when I get there, I was like, hey, I'm looking for this person, his first and last name. And they're like, well, what is it? Is it this last name or this last name? And I was like, it's both last names. Like, this is my husband's last name. Just all of it. And then they were like, okay, yeah, I see him right here. I'll take you back to him. And at this point is when the treatment by the nurses started to not be very great towards me. I can't read print. I couldn't read print that day. I couldn't read anything. So I couldn't read the sign on the door that said, do not pull door. I pulled the door. I am freaking out. I want to be with my husband. I pulled the door. And the lady just stared at me really angry through the window. Like, really? Really? It says it right there. Really? And then when I opened, like when the door finally opened, I said, I'm sorry. I am low vision and I can't read signs. And she's like, sure you can. And I was like, no, literally I can't. That's why he's like, this guy right here, this is not my husband. This guy is helping me get to the room because I can't see. And she didn't believe me, so that was kind of frustrating. But then we get into the room that he's in, and we sit down, we see him, he's doing all right, he's in a gown, he's upset because he doesn't want to stay the night, and he just wants to go home, and he's hurting, and he wants the IV out. But we're only there for like not even 5 minutes when they have a room ready for us, and then they take us upstairs. Wasn't bad. It's a big hospital. It is a really big hospital. So we get into the room that he's staying in, and it's on this floor that's like not occupied at all. There's no one there. It was just us that night when we first got there. I think more people ended up coming like later because like it was empty. The lights were off. It was kind of creepy when we were getting taken up there. So we get in there. The nurses, like, were kind of ignoring me. This is a military hospital. I get it. I'm not the patient. You don't have to worry about me. I get it. But, like, they were kind of mean to me. And they were like, why are you here? Are you staying? I was like, yes, I'm staying with my husband. That's my husband. I'm gonna be here with him. Like, sorry. And then, so we got there. We got in there. He got set up, everything. It was okay. The nurses were kind of weird, but that's it. We got up there about like midnight. By the time that he called me, it was like 10, and I got there. It was kind of a mess, so I don't know exact time, but yeah, when he called me, it was around 10, and by the time we got up to the room that he was admitted in, it was like midnight, and so we were just kind of getting ready for bed, and they had to do a few things. A few more nurses had to come in and out and talk to him, and that's it. They did not have a recliner in that room. They only had, like, the normal chairs that are in, like, the waiting rooms. So that's what I slept in for most of the night. At one point, they did bring up a recliner, and I did sleep on that for the remainder of the night. I didn't sleep at all. There was someone coming in. I know that's their job, so I appreciate them. I appreciate them coming in and medicating him, coming in and doing his vitals. I personally wasn't sleeping because I was so anxious. But at one point in the night, like, before we went to bed, a nurse came in. He's like, oh, you need grippy socks, and, like, threw the grippy socks from the door. And this is a pretty big room. This room is supposed to have 2 beds. It only had 1 bed in it at the time. And, like, hit my husband right in his IV. He said that hurt. And I was like, I'm sorry, I don't know. But, yeah. So, the night went pretty fine. It was okay. And then the next morning, they wake us up at 6 a.m. for a surgery that starts at 8. It was crazy. But we went downstairs to the pre-op. We stayed in there. They let me be in there with him for, before the appointment, the surgery. And they kept asking me, do you know how to get to the waiting room? Do you know where to go to the waiting room? And I was like, no, I don't. I'm also low vision. I might need more help than a normal person. And I know that's kind of annoying and frustrating, but just saying, I'm gonna get lost. And so a few of them were frustrated about that, but it was no big deal. The anesthesiologist actually took the time to show me how to get to the waiting room, and I really appreciated that, because there was like this thing that you had to pull up on the ceiling. I couldn't see it. So, yeah, but my husband went into surgery, and it was supposed to take 45 minutes. I somehow found my way to where I was supposed to go, and it took 1 hour and 45 minutes, so I was pretty anxious that it was taking so long. And then the surgeon came in and told me how it went, and he said it went good, everything's fine, he's coming out of recovery and everything, and that a nurse should come get me when it's time. And I told him, I was like, I need someone to come get me, because they wanted me to meet him up in the room that he stayed in the night before. And I said, I can't read signs. I'm so sorry. I cannot read signs right now. I do not know how to get back up there. And he said, okay, I'll tell them to get a nurse to come grab you. And, like, I wasn't the only one in this waiting room. There was a bunch of different family members that were waiting for their person to get out of surgery, and they all had nurses come get them. I was sitting in there for an extra hour until this nurse popped his head in, and he's like, Mrs. whatever. And I was like, yeah, that's me. And he's like, why didn't you answer our phone calls? I was like, what do you mean I didn't get a phone call? He's like, we've been calling you. And I said, my phone has no, there's no, receipt of, I didn't get a phone call. I was like, I don't know what you want from me. He's like, well, is this your number? And he read it off, and I was like, no, that's not my number. And 3 separate people asked me for my number, and when they wrote it down, they read it back to me, and it was the right number. So if all three of them had the right number, how do you not have the right number? But yeah, he was really mad at me. He's like, okay, so your husband is back up in his room, so you can go meet him there. And I was like, wait, I don't know how to get there. And he's like, what do you mean you don't know how to get there? I was like, well, one, this is my first time in this hospital. And two, I'm low vision and I can't read signs right now. I wasn't saying right now, I was saying I can't read signs. I said I can't read signs. And I need your help to get up there, or I'm going to be wandering around, the hospital this whole time. And I had my husband's phone, so he had no way to contact me. So he took me up there. He was really annoyed about it. He's like, oh, I can't believe this. And I was just like, I'm sorry. I do understand that you do have a job. I get that. I really, 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 really do understand that I am not important in this situation. Your patients are. That's why I don't know. I'm trying not to be upset about it because I get it. They do have a job, but it just, the way they were treating me felt like I wasn't a person because I couldn't see. And I don't think they meant it that way. It is frustrating that they had to help an adult get up to where her husband is, but at this point in time, I was already feeling awful because I couldn't drive there to be with my spouse, and he got bad news the night before. I wasn't there with him, and that was hard for me because I feel so guilty. I feel so guilty for my vision, for the lack of vision that I have and the lack of independence I have, and I don't feel like a reliable partner because I can't drive, and it's really hard. Okay, it's really hard, and that nurse treating me like that felt really not great, and I'm really trying not to be upset about it because, again, I'm not the patient. Technically, no one needs to help me, but it would have been nice if they treated me a little bit better than a burden and an annoyance. And every time I told them, I couldn't see or I couldn't drive, they really were like, you're an adult, you're married. They treated me so poorly because of it. And this is a week after I got, my vision exam, and I was told that my vision's getting worse. So that was hard. Yeah, I just, if they could have been a little nicer about it, that would have been great. But yeah, by the time I get up there, my husband's pretty much fully out of anesthesia, which I felt really bad because I wanted to be there with him when he came out of anesthesia, and I wasn't. No big deal. They didn't have the right phone number, and for some reason they didn't have someone come get me like they did for everyone else, but it's not a big deal. I get up there, his nurse comes in, and she was like, when did you get in here? I was like, me or him? And she's like, him. They never told me he got in here. You've been in here by yourself. That's not allowed. And she was upset, mad, but she was okay. And then they told us the requirements to get out of the hospital. We had to get his medication from the pharmacy. We also, he had to eat a full meal without throwing up or being in pain. And we also had to walk around, and he also had to pass gas and go to the bathroom. So that was all fun. He ate great, which he hadn't eaten in over 24 hours at this point because he ate really early in the morning on Monday, and it's afternoon of Tuesday by now. So he's hungry, and he's able to eat, which is great. He's able to get up and go to the bathroom and, pass everything that he needs to pass. So yeah, and we were managing his medication with ibuprofen and Tylenol, and that's what we had to get out of the hospital. And then the nurse came in, and she gave him this, thing to blow into or breathe into or something to make sure that he was fully taking a breath, because people after, I guess they get stomach surgery or whatnot, they don't fully breathe because they're worried that they're going to hurt themselves because it hurts. And they did tell me that they did have to remind him a few times to actually breathe after anesthesia. There was a few times that when we were in the room together that they had to remind him to breathe too. So they brought that in for him. He had to do that a few times an hour, and then they also brought in a stomach binder, and she said that would help make you feel better because you'll be able to breathe, you'll be able to do things and not be worried that your stomach's going to get pushed out because your incisions are right there. So he's been wearing that like crazy. He still wears it. He says that it makes him feel better. It makes him feel more comfortable. So he still has that. And yeah, we walked around a little bit. As gross as it sounds, I told him that he gets to medically crop dust me. That sounds so gross, but technically he needed to. And I can't smell. I don't have a sense of smell, so it didn't really bother me. But yeah, by the time that it was time for us to go home, the nurse that was helping him kept getting upset. She's like, why can't you go to the pharmacy? Why can't you figure it out? And I just had to keep telling her. I was like, I can't read signs, and I can do it, but I'm gonna get lost and it's gonna take me hours, and then someone's gonna have to come find me. Like, I cannot see, and I am in a very unknown place, and I'm uncomfortable, and I'm stressed out already because my husband just had surgery. I was like, I will do it, but I would prefer to have someone help me get to there so that I do not get lost and I do not, end up somewhere that I'm not supposed to. That's my biggest fear, is ending up somewhere that I'm not supposed to and getting in trouble or something. So she got really frustrated with that. She's like, I can't believe you just can't go to the pharmacy. And I was like, lady, I need eyeballs. I need someone with eyes that can help me I don't have a white cane. I don't have something that can help me get through the hallways. I don't have any depth perception. I have like almost barely any peripheral vision in this eye anymore. I'm gonna walk into people. So that frustrated her, and my husband's like, you know what, it's fine. Me and my wife can go down there and get the prescription when I'm ready to leave. And the nurse was like, fine. And then he was like, also, how long is this gonna take? Because I have to get a friend to come pick us up. And then she like looks over at me again, and she's like, she didn't even talk to me. She stopped talking to me at this point. And she looks at me and then looks back at my husband, and he's like, she can't drive? Are you serious? Yeah, I'm serious. I can't drive. Legally cannot drive, and I think that it's for the best that I don't drive because I can't see. And that was hard. He was like, no, my wife is blind. My wife is visually impaired. She cannot drive. Oh. So she kind of gave me crap for that. She's like, how'd you get here? And he's like, I drove. And she's like, you drove? Yeah, so that was, I didn't really like that because it made me feel even worse. Oh, and after his surgery, it had been an hour and he hadn't seen me, and he got up to the room. The only reason the nurse came and found me was because my husband, they were like, hey, I'm gonna leave now. Do you need anything? And he goes, yeah, my wife. She's visually impaired. She's probably lost somewhere. That is the only reason, absolutely only reason that nurse came and got me, was because my husband asked him to, because I'm visually impaired. So, yeah. And we got out a few hours later. We got out around like 3 o'clock. We got home around 4. It was crazy busy. We had a friend come pick us up. Our friends have been incredibly helpful and kind during this time. That is what happened. My husband and I have had to sleep downstairs because the stairs were kind of hard for him, and also he's not using his core because he's got 4 incisions on his stomach. There's like one pretty high up, then there's one like in the side, and his is indented. Like his skin, it looks like another belly button, but like sideways. It's really weird. Then he's got an incision in his belly button, and then like under, like really close to his his pelvis, and so he's having a hard time with sitting down on low things like our bed and then sitting back up. So the easiest thing has been for us to sleep in the recliners downstairs, and that's what we did for the 2 weeks. We're still sleeping on them until this weekend. He is also really scared to roll over on his incisions because they are very tender, and I don't really blame him. And he's been sleeping on his back. So, yeah, that has been recovery and surgery. So it's not crazy. It wasn't a bad thing. My husband said that they treated him great. He appreciated the way that they treated him. They respected him. They did that. I was very happy about the care that he got, but it was kind of disheartening to be treated the way that I was treated, especially after being told that I'm losing more vision, and I'm struggling with coming to terms with that. And I'm struggling asking for help. And I put myself out there and I asked for help. And they made me feel bad about it. But the story is not about my issues, it's about my husband. So we just had his post-op. He's like 15 days recovered. He's doing good. He's got a little bit of pain. He was out of work for 2 weeks. I was taking care of him. I pretty much had to do everything for him. I loved it. I am a caregiver. I was a caregiver for years. I want to be a caregiver again. So the second that he needed someone to do everything for him, I was on it. I was like, I'm useful again. I was having the time of my life taking care of him. And I know that it was hard for him to give up that control and needing help because, you know, I had a hard time accepting help when my medical stuff really ramped up. So I understand why he's kind of upset, but he's starting to do things on his own now, which is so sad. And he's back to work. He's been back to work for 2 days now. He is on light duty for a month, so he won't be doing much. Yeah, that has been his recovery story and his surgery, and it was great, kind of. I am very happy that it wasn't an emergency. Well, it was an emergency, but I'm really happy that it went smoothly. I haven't really sat with myself to really digest and feel the feelings that I had about it, because I'm the type of person that when an emergency is going on, cool, collected, I'm fine. But now sitting here talking about it, I'm like, I wasn't there. I wasn't there with my partner. My partner had to find that out alone. I couldn't get there to be with him. I had to rely on someone else, and that's kind of hard. I wasn't there when he when he woke up, and that's what I wanted. I wanted to be there for him, and so now that he's at work, I have time to sit with those, and it's hard. It makes me feel like not a great partner. So, yeah. I don't know. Yeah. So, this is what it's like to be visually impaired and have an emergency situation happen. And I'm really happy he's okay. I'm really happy, you know, everything went fine. It didn't rupture. He didn't have an infection. It was quick, easy, in, out. He was not very happy that it happened, which I don't really blame him. Yeah. So he's all good now. We're all good. We are going to try to sleep in our bed very soon, and I'm very excited. Yeah. So I appreciate all the good thoughts and messages that people have reached out to me with. Yeah. Sorry I went 2 weeks without posting. I really needed to be there for my husband. I was pretty much his beck and call. I was also a medication person. I did everything for him. But it made me feel useful. It made me feel a little bit better that I wasn't there when he got the news and I wasn't there when he woke up. And because I'm able to take care of him when we're in our home, I can be his caregiver. I can make sure everything's done. It's just when we're out in public that's hard. That is our story time of what happened and how the nurses treated me and him. But thanks for watching. I will see you in the next one. Oh, and if you guys have any questions, drop them down below. I don't mind answering them. Bye.